My name is Erica Logan, and on behalf of the Eastern Panhandle Alumni Chapter of Delta Sigma Theta Sorority Incorporated, I welcome you all to our program this evening. The purpose of tonight's event, COVID-19 Vaccine 101, is to provide information about the COVID-19 vaccines from a panel of experts in the field. We hope to answer many of the common questions and provide enough information to you so that you can make an informed decision about getting the vaccine. So here's how things are going to go this evening. First, in the next few minutes, excuse me, I'm going to invite all of you to complete a very brief survey. We just want to get a sense of where you are today. Then we're going to have a moderated discussion with our panelists. Then after that, we'll have some closing remarks. And then at the end, we're going to ask you all to complete an evaluation just to let us know how we did this evening. In fact, we're going to go ahead and put a link to the evaluation in the chat so that you have that now. Also, during the conversation, you are welcome to submit your questions in the chat, and we'll pick those up during the panel discussion and make sure that we get those answered also. So let's get started. As I mentioned, we would like for you to respond to a quick survey, just so we know a little bit about where you are now, how you're thinking about the vaccine. You should see the survey in just a couple of minutes. There you go. So you just want to go through and select the one statement that best describes your thoughts on the vaccine. The first one is, I've already received 1 or 2 vaccine shots. I haven't gotten the vaccine, but I'm willing to receive it right away. I haven't gotten the vaccine and would like to wait a bit before getting it. Or I do not want to get the vaccine. Or I'm undecided and I'm about getting the vaccine. Make your selection and then please click submit. I'm going to do the same thing. I'll give everyone a chance to do that, and we'll share the results once we have them. If you're just joining, you may see a survey on your screen. If you don't mind, please go ahead and complete the survey. Really quick, 1 question. Press submit when you're done. Okay. Are we still getting results in?
I think we're good.
Okay. Let's see what we have. Okay. So many of you on the call have received your shots already, and a good number of you will get it when you can. Okay, great. Thank you very much. All right. So now, EPAC is happy to have a panel of experts this evening who have made it their priority to educate the community, especially communities of color, on the benefits of getting the COVID-19 vaccination. So this evening, we welcome Dr. Akeza Teame. Dr. Akeza is board certified in internal medicine and infectious diseases in the US. The scope of his clinical expertise encompasses internal medicine, infectious diseases, travel medicine, and tropical medicine. He is a co-founder of 3 healthcare facilities in Addis Ababa, Ethiopia. Abyssinia Medical Center, a newly established clinic in Alexandria, Virginia, is the newest addition to the conglomerate of healthcare facilities established by Dr. Akeza. Dr. Akeza earned both his undergraduate degree in genetics and Doctor of Medicine from the University of Kansas School of Medicine. He completed his residency in internal medicine and fellowship in infectious diseases in Montefiore Medical Center, Albert Einstein College of Medicine in New York. Ghada Hamd has a career that spans more than 25 years in the field of clinical research. Currently, she is employed in Syneos Health, where she is the Director of Clinical Operations. In her role, she is responsible for overseeing programs for drug compounds and various vaccines undergoing clinical trials. Ms. Hamd earned her Master's of Public Health with a focus on epidemiology and biostatistics from the George Washington University in Washington, D.C. She earned her Bachelor of Science in Biology from Virginia Tech in Blacksburg, Virginia. Ester Jones is the Chief Compliance Officer for Odyssey Rehabilitation in Bridgeport, West Virginia, and formerly held the role as Vice President of Operations. She is a licensed occupational therapist in West Virginia and Virginia. She is also registered by the National Board of Certified Occupational Therapy and is a current member of the American Occupational Therapy Association. Ms. Jones is a certified dementia practitioner, a certified dementia trainer, a geriatric specialist, and a certified online training professional. Ms. Jones earned a Bachelor of Science in Medical Technology, Bachelor of Arts in Multidisciplinary Studies, and her master's degree in occupational therapy, all from West Virginia University. Our moderator for this evening will be Sharon Steele, who is also a member of our chapter. Sharon, I'll hand it over to you.
Thank you very much, Erica. And again, welcome to our distinguished panelists and for those of you who could join us this evening. Again, as Erica mentioned, we will have a conversation tonight about COVID-19 and its impacts on the African-American or the brown and Black community. So I'm going to get started and just ask questions that we've prepared for the panel, but we definitely welcome questions from those of you who joined us. So if you could put your questions in the chat as we go through this conversation, we greatly appreciate it. And as time permits, we'll answer your questions. So I'm going to go ahead and get started. And this is a question to all of our panelists. Can you please let us know what are some reasons that the pandemic has disproportionately impacted minorities? And I'll let Dr. AK go first.
Okay, well, thank you so much for the opportunity to share our thoughts here with the community. So when we look at COVID, the pandemic, it's important to look at it from two aspects. Number one, the nature of the infection. The nature of the infection, what kind of people does it affect the most? If we look at, you know, the people that have been, as you know, most of the people are asymptomatic, and the ones who have been affected the most, or the ones we have lost, are people with advanced age and people with underlying medical conditions. Okay, so underlying medical conditions, that's a very important issue here to discuss tonight, because everything will be tied to that. So it's an opportunistic infection, not in the classical sense of the term, but it's a virus that takes advantage of the fact that the patient has a weaker immune system or other underlying medical conditions that makes them more susceptible to the complications, okay? So that's one. So the second is to look at what are the factors that make the minority community more susceptible to this virus. Is the healthcare, the inequality or the inequity in healthcare services, okay? So to begin with, it came at a time when the issues in healthcare disparities were being discussed and some steps were taken in the right direction to address this disparity, but not enough has been done to change the course of history. So because of that, if you look at the disease prevalence in the racial and ethnic minorities, hypertension, diabetes, cancer, asthma, COPD, okay? These are medical conditions or comorbidities that are highly prevalent, okay? Then you talk about access to healthcare services, which is significantly less in comparison to other communities, okay? So the fact that there was a predisposition to the disease, as well as not being able to have the care that our communities need, is what made the disease win in that community the way it did.
Thank you very much for that. And we definitely, a lot of us have heard exactly what you said about the disparities in healthcare and how those, just the disparities alone make it more, the idea that COVID would impact minorities more. So Ms. Ghada, do you want to add to that?
Yes, so adding to what AK said, well, first, thank you for having us all today. Educational, also income and wealth gaps, big gaps when the, between the minority, our minority population and or amongst our minority population, limiting, opportunities for good jobs. And they end up a lot of times having to take jobs on where they are exposed to the virus, or they actually are not able to take time off to get health care, even if they do have, insurance. They will lose, income if they don't work those hours. So there's a lot of factors in that sense. There's also housing. A lot of minority groups tend to live together. You have multi-generational families. You also have just, people that live in groups. A lot of minorities, a lot of immigrants tend to live together to reduce housing costs. And so once one of them gets the virus, it's easy to then transmit to others amongst the household. So that also plays a big factor in the transmission and the prevalence of the illness amongst those groups.
Great points. Ms. Esther, would you like to add to that?
Once again, thank you for having us as well. I think they did a great job in explaining some of the reasons that there is that disproportionate effects of minorities disproportionately. I think another, so kind of tying into both comments that have been made so far, those comorbidities, all the things that we have, all those diagnoses that are related there. So we don't normally just have high blood pressure. It's that someone has high blood pressure and diabetes, so we have those multiple comorbidities that put you, even when you are exposed, put you at a greater risk of having a more severe case of the coronavirus. The other thing I was going to mention, even related to housing and our family dynamics, is that a lot of people, once someone does test positive, I know we're going to get into further discussion as far as education and things go, but I feel like we automatically assume I'm not going to get it. I know my mom has it. I can still go visit her, because I always go visit her on Sundays, and she's not cooking dinner now, so I'll cook it for her. But we're not taking those added social distancing practices. I'm not taking that into consideration. So.
Right. And so, given all of the reasons that you all just gave, the fact that whether it's economic gaps, the education, health gaps, and all that sort of stuff, to you, Ghada, the question is, given that we are disproportionately more likely to get COVID, but then our history of vaccination and what the history of African Americans or people of color and how we've been used in trials, for vaccinations, can you please tell us a little more about the clinical trials that they've been doing on COVID and why we should have confidence that we now should be taking the vaccine?
Right, sure. So in general, vaccines are safe. There are some side effects, but for the most part, they are safe. And then when you consider the disease that you could get if you don't get vaccinated, for example, measles, you could have tetanus, you could have life-threatening diseases versus taking a vaccine that will have some side effects. Even from this current vaccine, we've seen so far, whether during clinical trials and even after it has been approved and being given, that there are some side effects, minor, and just very few that have maybe been a little bit, extreme, but then it hasn't really been confirmed whether they are related or not. Some are still under investigation. So in general, vaccines are safer than actually getting the disease. So we understand why our Black and Brown people are not comfortable with, clinical trials or being vaccinated, and just, even clinical trials for drugs. We all know about Tuskegee. Actually, events were happening even before Tuskegee, and with Tuskegee, I'm sure everybody knows, but there's about 400 Black men who were not offered the opportunity to get treated for syphilis. And so, but then you had other incidents as well that have happened in history amongst, Nazis, Cold War. There was the radiation, trials that were going on. So a lot of abuses internationally. And as a result of that, the international community has come together to develop standards and regulations for any trials that are being conducted for vaccines and drugs. So to prevent a lot of what has happened, all the abuses that have happened before. So in terms of clinical trials, we always think of the pharmaceutical companies and the pharmaceutical companies that are making a lot of money, but they're not working alone, and they're not doing whatever they feel like doing on their own without any oversight or consequences to what they do. There are multiple players. You have the pharmaceutical companies who own the compound, whether for a vaccine or a drug or even a medical device. You have a company that would be like a contract service, a research organization. That's kind of like where I work at. We provide services to the pharmaceutical companies to conduct the trials for them. We act as kind of almost like where we are an independent entity to conduct the trials for the pharmaceutical companies. It takes away some of that conflict of interest. You also have the FDA here in the US. I'll talk a little bit more about their role and what they do. And then of course, for every trial, you also have what's called an IRB, an Institutional Review Board. So I'll start off with the Institutional Review Board. The IRB was actually developed after I noted earlier the abuses that have happened internationally. They came up with international standards, and these standards are now, they're followed by the IRBs to ensure the safety of the subjects, to ensure that whatever is being tested is actually beneficial, and to ensure that all the studies are being conducted ethically. So with all that oversight, they have to review, do a formal review of what's called a protocol. The protocol is usually hundreds of pages at times. It's very detailed as to what is the rationale of the study, what is the compound that they are studying, what is going to be done to these study participants, the human beings. What are they, how much blood is going to be taken from them? Where's this data going to be used? How is it going to be used? And just the science behind the study. So then each protocol also has a consent form that goes with it. The consent form is what's given to every study participant. It again describes in detail what's going to happen during the study, how many visits they have to attend, and how much blood is going to be taken, all the any EKGs, anything that's going to be done is going to be in that consent. It gives every participant is supposed to have enough time to review. They're usually given the consent to take home ahead of time to review it, really to get an opportunity to ask any questions, whether they come back to the clinic with it later, or just take whatever time, talk to their own doctors about it. So to participate in the clinical trial, really having that sense of comfort and knowing that, you have, all the information before you actually agree to participate. So the protocol and the consent form are all reviewed by the IRB. They must be approved before you can even start your study. And the FDA also has to approve of what is going to be how the study is going to be conducted. They actually have a say in how you should conduct the study, what you should look at. And if pharmaceutical companies can't meet that, it just doesn't, they're not able to later submit it for approval. The process does usually take a very long time, and FDA reviews also, usually take a long time. The other players you have are the physicians. I know, like, for example, in Tuskegee, physicians were able to do what they wanted to do, in terms of giving or not giving treatment. First of all, for a physician to be able to participate in a clinical trial, they must be qualified, they must be properly trained, they must also not have had previous findings from investigations conducted by the FDA, which they do regularly. And sometimes they're even barred, so you wouldn't want them you can't have them participating in your clinical trial. The physicians also have to conduct what they participate in is a double-blind study. A double-blind study is the gold standard for any drug that has to go through multiple studies. The double-blind is where neither the physician, nor the study participant, nor the nurse, nor the pharmaceutical company, nor the CRO or FDA or anybody knows what the subject is getting. There's usually a randomization code that is used. That person that generates the randomization code would be the only person that would know the treatment, and they don't even know the subjects. They don't see the subjects. So that's a safeguard to ensure that a physician cannot decide who actually gets the treatment or not, which, because as I noted, the gold standard is to have the double blind where you have the treatment or placebo. And placebo is a non-active drug that's given, and so to compare with the active drug. So there are multiple safeguards that are placed for clinical trials. Also the data that's collected, it's collected in a certain way. It's being monitored and audited on a regular basis throughout the clinical trial to ensure that the data is accurate, makes sense, complete, and is auditable by the FDA, which they can conduct audits and inspections during the clinical trial or even after. So again, lots of safeguards, but with COVID specifically, one other aspect is that the whole world is watching. The whole world is working together on this, and the whole world is ensuring the safety of these vaccines in order to stop this pandemic. So, when you think of a Pfizer or Moderna, they're not working on their own. They're not collecting the data independently. They're not reporting independently. They're not making up data. They're not able to do that. So those are reasons to ensure that they're safe.
Well, as you're talking about COVID, to listen to you talk about the process of what it takes to get a vaccine to market, if you will. But we see that COVID, the COVID vaccinations made it in record timing.
Right.
And so hence why a number of people are hesitant about taking it as well, because they feel like it should be this long, arduous process. And now you're saying it, and we all watched it come out in like months. Right. So what do you say to people who are like, I heard Ghada say it goes through all this stuff, but yet this one came out in record timing.
Right. So what the world has done, what the FDA has done, we can talk about the US, focus on the US, is that they have put a halt on doing any reviews on other drugs and vaccines that are not life-threatening. The focus has become on COVID. So when a pharmaceutical company does their clinical trial, or before they even do it, when they come to submit to get approval to proceed, the FDA, that's their priority. They cut the red tape. They have lots of staff that are focused on doing the reviews, so the reviews can get done quickly. They can't cut, there's no shortcuts. The FDA has their reputation. They have to ensure the safety of the citizens. But that's really what happened. The compound was actually already identified beforehand. They did not come up with a compound January 2020 or February 2020 when they decided this was a pandemic. No, scientists had already been working on. So that long process that usually takes 9, 10, 15 years, it had already started. Preclinical work in animals had been done. Lots of trials had already been done, identifying the genetic sequence of, kind of how to, in terms of creating new vaccines. We have new technology that also helps to do that a lot quicker. So that's where a lot of time has been cut. It's not in, the time was not cut in following patients or conducting the clinical trials. It was cut in, where the reviews, the bureaucracy, the red tape, that's where the time was cut.
So that's really good to hear. And I'm going to jump back to you, AK, for a second, because we had a question in the chat, and I also want to get your take on it. Is now that we know that the red tape was what was cut in trying to get this to market, we also keep hearing about the different strands of the of COVID that are out there. So when we think about the long-term effects of the vaccine and how might we what we need to do in the short term, one of the things people are asking is, given all the strains, the strands, if you will, that are out there, and you're on the global market, so you see, you're in the global space, so you see what's happening in Ethiopia and other parts of the world. What are we doing, considering how the pace we're trying to bring out the vaccines, the number of strands we keep hearing about? How confident do we make people in these vaccinations, given what we see happening with the number of strands, as well as people not sure of in the short term, am I vaccinated against this strand, and those sorts of things.
Okay, so before I answer that, just to add one thing to what to the excellent explanation on the process of vaccine development that Ghada talked about. We have to also remember, usually for a vaccine, the pharmaceutical company or the manufacturer may invest about $1 billion. That's on average, that's about how much it would take. And, when they go through the, various clinical trials, like if in the first or second phase, it's not promising, they don't move on to the next one because, for economic reasons. But when it comes to COVID, what happened? Because of the nature of the urgency, the government and the pharmaceutical companies basically said, money is not an issue, okay? So there was unprecedented level of collaboration between pharmaceutical companies, the academia, and the private sector. So we've never seen that kind of collaboration in drug or vaccine trials. So there was so much money that was pumped into this trial that scientists could afford to run certain things simultaneously without having to be conservative with the steps that they take because of economic constraints. So that was eliminated. So that also contributed. The second thing that I wanted to add is, historically, vaccines are developed either from, we either give a weakened virus or a dead virus to induce immunity or to induce immunogenic reaction. But in this case, we used a technology that has never been used in vaccine development, is the messenger RNA. So the fact that it is a different technology and it didn't involve a live virus or a weakened virus or any viral component also minimized the risk. Okay, so these are the things that contribute to the fast development of the vaccine. But when we talk about the variants, there are already numerous variants. I don't know if you guys saw today. It was I think it was on the New York Times. They were saying by the end of March or April, the new variant may be the dominant strain that would be circulating in the US. Okay, so there is a concern because we know, even though the vaccines that have been already approved and that are being used have good coverage against this variant, we also know that the immunogenic reaction that is being induced by this, the immune response that's induced by this vaccine is less when it comes to the variant. But there is a reasonable expectation that the current vaccine will be still good enough to cover the variants that are circulating. That's one take-home message. The second take-home message is, because now we know how to tweak the vaccine, just with viruses, what do? They mutate. That's what they do. That's why we have the flu vaccines, every winter we have a new vaccine. Why? Because, there is this ongoing mutation. Viruses, that's what they do. And through that evolutionary change, some of them will die, but some of them will become stronger and more infectious, or more, they'll be more virulent. So in this case, that seems to be the case. The variants are, they tend to be aggressive. People tend to be more, the symptoms tend to be more severe. But I think the vaccines are going to work, but more importantly, with, they can tweak some of, the genetic component of, the vaccine, and so it will be similar to the flu vaccine in that sense. So this is not going to be, I'm not concerned, and that this should not be a major concern.
Understood. So Esther, I'm going to ask you, since your clinics are actually administering the vaccine, just curious to know what type of side effects, if any, are you seeing in people?
Okay. As far as the side effects go, of course, everyone kind of, well, actually, I won't assume everyone knows, but the side effects tend to be pretty standard, as you would see in, for example, AK had mentioned the flu vaccine. So, the soreness of the arm, maybe a fever, flu-like symptoms, feeling a little run down, muscle aches. So as far as our facilities go, we've seen everything from no side effects to the most severe as far as side effects go. We've had some employees that missed 1 or 2 days of work, because I kind of wonder how much of that was needed to be missed, but they took advantage of the fact that their side effects, they felt stronger than others. I know one of the things that they, which we've seen, and I've read as well, is it seems like the younger you are, the more likely you are to have some of those side effects, experience the side effects. So for instance, we contract into skilled nursing facilities, assisted living facilities, critical access hospitals. So it tends to be the more of the elderly population that at least I see. And with that being said, none of our residents have been complaining about any of the side effects. It's the workers that tend to have more of the side effects. Even with that being said, out of the company I work for, we have a couple hundred employees, and I've had 3 that actually missed any work time. And so to kind of put it in perspective for you. So I definitely,
go ahead.
No, go ahead.
I was going to ask, once people get vaccinated, and it's interesting that you're talking about the older population, of course, they all want to see their grandchildren and get out and touch and see people. So once people get vaccinated, what can they reasonably expect that would be different among their daily life?
Right. Well, I would say the first thing is that some people, there's a lot of misperception out there. And the one thing is not that once you get vaccinated, you can take your mask off and hang out with everybody and pretend like COVID doesn't exist. So, so the one thing to remember is that it's more important to continue to practice all those social distancing, wearing your mask and, washing your hands and all that, avoiding the close contact. So what I will say, kind of back to the, as far as the nursing home residents or elderly population goes, not only have we seen less side effects, even as far as nursing homes go, there are less cases. And so we're, our therapy company, we contract PTOT and speech throughout the state of West Virginia, a couple places in Virginia. Out of all the facilities we're in right now, there's one resident that has COVID right now.
Wow,
So
wow.
so what we're seeing more are because the younger population are the ones that still feel like they're invincible,
Exactly.
that they're not going to get it. If they do get it, it'll be a low, they're not, because their friend got it, they didn't get sick, so I won't get sick. So that's what we're kind of seeing now, or that there are employees that are actually, tested positive that did not get the vaccine. I will mention one other thing real quick, is that even in one of our facilities, which anyone who's used to the nursing home environment, or a lot of companies have morning meetings where you get a lot of your department heads together before you start your day.
Right.
We have a facility where all of the, I'll say the 40 and up crowd actually got the vaccine, and the we'll say the 30s and under declined. And they have that morning meeting, and they try to do their social distancing and all. But ironically enough, one of our facilities, someone younger tested positive for COVID, that was a department head, was in the meeting. Every single employee in that meeting who did not get the vaccine tested positive for COVID.
Oh, wow.
So, really it does go a long way to push. I don't understand, I do understand, but hopefully even doing something like this, providing that education so that we can dispel some of those misperceptions, we can get more people vaccinated so that we have less situations like that, because that's what we're seeing now, are the younger people testing positive.
Well, it's interesting you say that, because, now the big debate is reopening of schools, wanting restaurants to open and that sort of thing. And given whether it's, colleges have opened to some degree, but they're not fully open. So Ghada, I'm going to bring you back into the conversation about, is it safe? Is it safe to be reopening schools? Is it safe, to increase the capacity of restaurants and those sort of things, especially given what we just heard Esther say, or what you think about that just in general?
So this is going to be my own personal opinion more so. I don't think so. Mainly because we tend to, as human beings, want to get comfortable. You're going to have a lot of people who are going to school or going to restaurants, and they have not been vaccinated yet. And they're going to think, well, others are vaccinated, so we're okay. But they're not thinking that they're not vaccinated. And even if you're vaccinated, you still can be a carrier. So it really is not safe yet. To at least for restaurants, I really want to support the businesses, and I still support the businesses and always order from restaurants takeout. But we really have to think about this, the big picture and long term. In terms of schools, it's really hard, because I do understand the impact, mental impact, and educational impact it's having on kids for them not to be in school. I know a lot of states, I'm in DC, and they made it a priority to get teachers vaccinated, which is a step to making it safer for schools to reopen. But again, I just don't think we're there yet to really fully open. And I think some of the recommendations from the CDC were, to open schools based on different areas, based on, the prevalence of the rates of the infection. So. Yeah, this has been the toughest part of this whole pandemic, really. Yeah.
AK, your thoughts on whether or not things should begin to open up, whether it's schools, businesses, restaurants?
I am in agreement with Ghada 100%, because we have seen the repercussion of similar decisions, in the last few months. And as you pointed out, all of us want to see the businesses, to be open and life to resume and life to go back to normal, but we cannot afford to deal with the crisis that we've been dealing, as a result of such, irresponsible acts. So I don't think we're there yet.
So Esther, I'm going to ask you your opinion on that. Now, also, there's a question in the chat regarding when the vaccination is going to be available for children 16 and under, and wonder if you could, if you know what the timelines are for that.
Go ahead, Esther. No, go ahead.
I'll answer the first question, then I'll pass it to Ghada for the second. So, as far as being ready, schools being ready to open, I do agree that there's a lot of concern. I agree with Ghada that it should be, based on, the prevalence in that the county. With that being said, I know that someone also mentioned that West Virginia, the schools are officially open now. It is important to remember, to realize though, that is a gradation of opening. The K through 5 is actually fully open starting Monday. On Wednesday, they're taking, getting, 6th and up, and then they're going to be, it's my understanding that even high school is not mandatory. So of course they're doing that based on the likelihood of the younger children being able to actually get COVID and severe cases of COVID. We know there's some people, some that can, but they're really, I do feel like it's still important to remember a couple things. Is one is that there still are studies, out there that kind of show that age range and what's going on, what they tend to, how serious the infection is that they, if they would get it. We do know they could be carriers and take it home, which obviously becomes another issue. I feel like the other part that's important for us to realize is, and I can speak for the state of West Virginia, whether we like it or not, we're open and we're starting on Monday. So, so we have to have a plan B, so we can dig our heels in, or we can have a plan B, which really should have been plan A in the first place, which is continue to practice social distancing. My youngest son is 13. And I'd like to believe that myself and my husband have kind of ingrained in him this COVID vaccine, but he sits by himself at lunch. He doesn't sit with his friends. Keeps his mask on all the time. He keeps his distance regardless of what's going on. We do know there are going to be some kids that want to come back, and maybe even because some of their families have given that impression that whether they don't want to wear masks, they don't think they really work, all those things may not have ingrained that in their children. So I really feel like, everyone who's listening to this, and tell your friends, and that it's still important to practice all those social distancing as much as you possibly can, even in that school environment.
So Ghada, to the question of when it would be available for 16 and under, and I'm also going to ask you a question from the chat about women who are planning to be pregnant, and what the potential side effects of the vaccine are for those that are planning a family.
Right. I'll talk about the children first. They have at least Moderna and Pfizer, who are in the US, have started already testing in the younger age group. I think they're looking for results towards summer, fall time. And of course, that needs to be reviewed. But as noted, everybody's, they're expediting. So I would think maybe have something by, I don't know, in the fall, early winter for the children. And then in terms of pregnancy, I would say, each woman should really speak to their physician to discuss how to proceed with the vaccination. But I think AK could also add to that.
AK?
Yeah, so as you know, these vaccines, both vaccines, were not, during the trial, pregnant women, lactating women, and children were not included. So because of that, we don't know, if it would adversely affect that group of population. But the thinking is, given the nature of the vaccine, the fact that, it doesn't have a viral component, the general feeling is that it should be safe. but we are advised to advise our patients that to disclose to them that it hasn't been tried, but the general feeling is that it should be safe. And if they're expecting or if they're breastfeeding, and then if there are no other reasons to make them more concerned, I think it should be reasonable to have that discussion so that they can get it.
So based on what you all are saying, I'm curious to know, and we did the poll at the beginning of the conversation about what are you hearing from people in the community as far as their willingness or hesitancy to take the vaccine? We know we hear on the news, but I'm curious to know where you are from your perspective, what your thoughts on how people are really receiving the vaccine or not. Oh, Esther, go ahead. Sorry.
So, we see the gamut. You have people that are waiting for their turn, like impatiently, waiting in line. You have some people that after they hear some of the dispelling some of those myths are with hesitation, but know that they should get it and they get the vaccine. You have some, I mentioned I have a 13-year-old. I also have a 26-year-old. When I told him I got the vaccine, got my second dose on January 8th, so I've had it for a while. But when I told him back in December that I was getting the vaccine, he told me if I turned into a zombie, he was going to kill me. And I was like, so you kind of have that still those younger ones think they'll take their chances. And every time I talk to him, I'm slowly wearing him down. I think I have him talked into when his time comes, because of course you have the phases of the rollout for the vaccine. I think when his time comes, I can get him to get one now. So.
Well, very good, Mary. We hope we're cheering for you.
Yes.
Ghada?
So I'm in DC, and my immediate community, everybody is really trying hard to get it. The vaccine. Anytime they've had a rollout based on eligibility, the website crashes. And just even amongst family and friends, I think I've seen a trend of hesitancy at the beginning and a change of heart by now. And I think part of it could have something to do with the what we felt was political involvement in the process of the development of the vaccine. And I really do feel when Pfizer came out and waited until after the US elections were done and then stated their results and confirmed that they didn't actually get funding from the government, I really do feel that really helped kind of have people understand that this was done independently. So even though, it is important to have government funding because like, AK said, it costs billions of dollars to develop. So having funds from all parties is very helpful. So I'm optimistic, and I do see a more positive shift to people wanting to get the vaccine.
So AK, I want to ask you, so in asking you this question, they've talked about how the only way we're going to get this virus under control is if we control it globally. So from your perspective, and when you think about the global impact that the COVID has had, what are their perceptions of the vaccine and whether or not to take it? Are they hesitant or are they open to it? So I'm curious to hear your perspective on that.
Thank you. So just to give you a couple of, just to give you an idea, but 10 days ago, there was a similar platform where I had the opportunity to talk to the Ethiopian community here in the US and in Canada. And many people said at the end of, we didn't, it wasn't as organized as this one, and we didn't take a survey. But many people said, after that discussion, that they felt comfortable that they were going to take it. And as you know, the controversy, out there, or the conspiracy theory is just crazy. People believe that you take this vaccine, like Esther said, people think that, all of it, like is going to alter their genetic makeup, and they're going to be like, a dinosaur or something like that, There are people who truly believe that. And it's like, so I have to explain to people, like this is a messenger RNA. It doesn't even get incorporated into the DNA of your cell. It just stays in the cytoplasm. It gets destroyed after it, sends that message, like it gets shredded, and it's like it doesn't, so it needs to be explained in that manner. And so people are, very receptive. And when you look at the global scenario, as you may have heard, I think only 8 or 10 rich countries have been able to get this vaccine. So the rest of the world is just waiting until these rich countries, these wealthy countries, have vaccinated their population, so that we can get our hands on this. And there is a vaccine that was developed in China, and I think they imported it to some African countries. And today, I read somewhere on social media that the Chinese government confiscated 5,000 or 3,000 or 5,000 vials that were sold as vaccines, but they were just selling. There was nothing. It was like, so when you hear things like that, it's very difficult. It's very unfortunate, but there are people who are going to try to capitalize on this unfortunate, disparity again, like at a different level, outside the US, we're talking about the disparity here in the US, but, like multiply it by 1,000 folds, when you talk about what's going on, like in Africa and other developing countries. But, even there, like most people are willing, not only willing, but, they would take this vaccine in a heartbeat. But the young ones still, they are they are as hesitant in Ethiopia as they are here, because number one, they think that, what, my friends got it and they didn't even know that they had it, and everybody's fine. I'm not going to take that risk. So that's how it is.
Yep. So I want to invite everyone to give like your last minute, in 1 minute, give your closing remarks and what you want people to know about the vaccine. So I'll start with you, Ms. Esther.
Thank you. I would say one thing, I know we talked, well, one thing I would say is that in most cases, it should be free. So for one thing we hadn't talked about yet, but the vaccine itself should be free. I would also say, I know I used to be a Kappa Diamond a long time ago. And when we were pledged, one of the things they said were, what we said all the time, were excuses are monuments of nothingness. So, some of the things I feel like if there's resistance to get the vaccine based on, I know there's fears and things out there, but based on some of the excuses I feel like people make at some point, like challenge someone to help you to get past those. Like what, instead of saying I can't do it because, say I can do it if. And so ask those questions. I'm grateful to you all to even have a platform like this where we can actually be able to provide some education, to the communities of color. So that would be my last. Oh, one last thing I would say as well, which Ghada, I'm glad to hear you go into the detail about kind of how the studies and everything that we do to get to this point, because I also had someone contact me, or someone I was talking to just last week, when I told them I got the vaccine, I was one of the first people, in West Virginia to actually have be afforded that opportunity. And what I was told was, well, but you got the white version of the vaccine, and that's why you're okay. So I was really happy to hear you go into that detail about how, the vaccine is out there, so and available to all of us. So that's all I have. Thank you.
But no, I think that's great. The idea of I can't do it, but I will do it if, and coming in with that mentality, I think that's a great approach to it. Ghada, your last minute.
Yeah, so just to add to what Esther said, also in the US, there are multiple companies worldwide working on these vaccines. And in the US right now, we only have Pfizer, Moderna, and then Johnson & Johnson's vaccines. It's very limited. Again, it's regulated by the FDA. I have a family friend in United Arab Emirates who got a vaccine from China. I almost, I kind of, was taken aback. I was like, oh, okay. But we're protected. We're being given the best of the best while we're here in the U.S. And then education. I think what you're doing by educating everyone is critical in terms of, getting everybody to really understand how, the safety of the vaccine and why we should all get it. But I think just like, reaching out to the Black and Brown communities, I think the younger generation also needs some additional outreach because they already feel they're invincible. And now that, yes, they have friends that have gotten it and maybe didn't have it so bad, they really don't feel it's important to get, but it is important for the younger groups to get it as well.
And Dr. AK, you get the last word on the panel this evening. 1 minute though, 1 minute.
Okay, thank you. So, number one, this pandemic will pass, but all the other healthcare issues that we raised at the beginning are going to stay with us. So let's make sure, this movement of educating, the communities and advocating for improving the infrastructures and lifting the barriers should continue beyond this pandemic.
Yeah.
Last point, as the Black people and brown, in general, the racial and ethnic minorities are underrepresented in vaccine development as well as in other drug trials. And again, the earlier point reasons contribute to that, but also their doctors do not inform them about the opportunities that are out there. And it's very important to have a physician that you trust in your community, in your respective communities, wherever you are. Have physicians that you trust, physicians who will advocate on your behalf, on your communities, all the time. That relationship is very important, and that's my last comment.
No, that's great. The idea that we continue the conversation around what we started with and the underlying disparities in healthcare in general, and then to the point you made that we need to start participating in our own recovery, in our own making sure that we are represented in everything, that we do need to take that on. So thank you all again for the conversation. I enjoyed speaking with you this evening. I want to remind the audience that there's an evaluation in the chat, so please take the time to complete the evaluation. And now I'm going to turn it over to Michelle Barnes to give closing remarks. She is the chair of Physical and Mental Health, our Physical and Mental Health Committee. So thanks again.
Good evening, everyone. Again, on behalf of the Eastern Panhandle Alumni Chapter of Delta Sigma Theta Sorority, I'd like to take the opportunity to thank the panelists, Dr. AK, Ms. Ghada, Ms. Esther. Thank you so much for providing informative, solid information. The goal this evening was to have an opportunity to provide folks information where they could make an informed decision when the opportunity is presented, if they choose to or choose not to get the vaccination. And you guys came through with that. So thank you so much for taking the time out this evening to participate in this. Again, Dr. Marsh was on the line with us. He had to drop for a meeting. Again, the importance of the West Virginia Czar participating in this forum. One, we need to ensure that our state is doing all they can to support us in this effort. So again, we are fortunate we're receiving solid information, and then in turn, we're holding folks accountable who need to continue to make sure those efforts, how the vaccine, as far as looking at how we're getting the vaccine, looking at funding, things of that nature, how those things are applying to our communities. So again, just thanking everyone for participating in the program. Reminding everyone again, as you were reminded earlier about the survey, please ensure you take the time out to complete that survey. It's very important so we know what type of information and things that could be helpful in the future to you. I know we had a quick slide just really quickly to provide information as far as making sure everyone here in the state of West Virginia, make sure that you do register online, vaccinatewv.gov. Please ensure that you share this information with your family and friends. If you know of folks who are having issues, help people. Reach out to folks. We know we have elderly folks that need help with this at times. This is a time we work together. Again, vaccinate.wv.gov. Encourage everyone to go onto the website to register. Now we're seeing such an open, it was like a bottleneck before, but now we're starting to see, movement with getting the vaccine out. Now we have other choices other than the health department. We have organizations that are now providing the vaccine, Walgreens that are now involved. Now, and I understand Walmart and CVS are also going to be on board very soon. So again, thank you so much for having the opportunity to participate in this forum. I truly appreciate it from my heart. Thank you.
Thank you.
Thank you.
So again, thank you everyone for joining us, and have a great evening. We put in some contact information up there for you. So if you ever need any assistance with getting registered, please use those phone numbers, as well as feel free to reach out to EPAC Deltas if there's a conversation that you'd like to have in the future. We'd love to be a part of that. So have a great evening, everyone, and we look forward to seeing you again sometime. And please do the evaluation.
Bye.
All right. Bye.
Thank you.